See, why we are doing the Vaman Dhauti in early morning? Because in early morning, what happens? See, there is a proper digestion of the matter. Okay, so there is no food matter, too much food matter in the stomach. So the digestive process, yet it is already completed. So it is better, or sometimes it is on the path of completion.
In addition to the digestive system, I've also heard that there's benefit to our joints.
Yes. Because what happens due to that fermentation and due to some toxic materials comes in the blood, there is a diseases like rheumatoid arthritis. There is a diseases like osteoarthritis, also some gouty arthritis. So when you are doing Vaman Dhauti regularly, we can avoid such diseases by avoiding the toxic material which goes in the blood. Since that vagus nerve supplies to the trachea, you see, these are the bronchus and this is the bronchial tree.
And since if it looks like they cover the camera, it was unable.
Now what happens? This vagus nerve stimulates your trachea, the branch stimulates the bronchus. Now first thing is that it stimulates the mucosal layer. You say the mucosal layer which is inside the trachea, inside the bronchus. And this mucosa is ciliated mucosa. You know the cilia? Yeah. It is a hair-like projection. And it stimulates the ciliary action like a wine, flow of wine. And due to that ciliary action, what happens? That ciliary action means towards the mouth. And so there is a movement of the mucus, sticky mucus. First is due to vagal stimulation, there is from that mucous membrane there is a secretion of mucus in large quantity. And so there is a liquefaction of these sticky substances, sticky phlegm. And then due to these ciliary movements, that phlegm comes to the trachea in the throat and it is thrown out. You see, after Vaman Dhauti also there is an act of and like this. So the sticky part which remains in the trachea, which remains in the bronchus, can easily come into the throat and expelled out during the process of Vaman Dhauti. So it is due to the action of vagus nerve or stimulation of vagus nerve to the mucosa of the bronchus and trachea. So there is a hypersecretion of mucus, and so there is a liquefaction of that sticky substances, and so there is a proper drainage. Due to this ciliary action, there is a proper drainage of the mucus up to the throat and then from throat to the. So you see, whenever there is a coughing or whenever there is no proper expectoration, we have to give Vaman process or this Vaman Dhauti to stimulate vagus nerve, and that's why to stimulate the act of expectoration. So it enhances the act of expectoration. So that what happens? We can reduce the attacks of bronchial asthma. We clears the bronchial pathway. We clears the tracheal pathway. It is very important because in trachea there is no too much obstruction of the mucus. Where is the obstruction? In the bronchial tree. Light नहीं आएगी क्या? See?
अंदर की लाइट जला थी.
Okay. See, once that here is the good diameter. You see, diameter of trachea is good. Also bronchus is good. But when there is a branching of the bronchus in the bronchus, slowly that diameter reduces. So in the tertiary branches of the bronchi, there is very low diameter. What happens? If there is a collection of mucus, it blocks the airway. And so there is no proper oxygenation or there is no proper movement of the gases, and that makes the problem. Whenever there is a blockage, suddenly there is a reflex like bronchospasm. So the collection of viscid mucus in the secondary and tertiary branches of the bronchus gives bad stimulation to the bronchus, and there is a constriction, and so there is a narrowing of that pathway, and so there is a hypoxia, or there is a breathlessness, dyspnea. So in the patients of chronic, whenever there is a chronic bronchial asthma, always there is a, with bronchospasm, there is also collection of some unwanted mucus in that bronchial tree. Now the act of vomiting or regular Vaman Dhauti clears that tertiary and secondary branches of the bronchi. And due to that clearance of path, it makes easy and it relieves the spasm of the bronchus. Okay, so it is a double benefit. First, we can remove the waste material which is in the bronchial cavity, and also we relieve the bronchial spasm which is due to the waste material in the bronchi. So it is very good remedy for the bronchial asthma.
Okay, even when you have like a chest infection, or when you have a chest infection, is it okay to do?
See, that in contradiction we have seen that yes, if there is a chest infection or lower respiratory tract infection with fever, that is in acute infection, don't try any heart procedure or don't try any such a procedure like Vamana or Virechana. Firstly, clear that infection. But after the clearance of infection, we have to clear the path. We have to remove all the waste matters which comes as a product of inflammatory processes. Okay, so to remove that matter, otherwise what will happen? There is a clearance of infection, but since the matter remains in the our tract, it becomes then there is a possibility of chronic infection or chronic inflammation. So avoid that. We have to give that woman after the infection. So whenever there is a fever, you see. That is my clinical criteria, that whenever there is a fever and weakness, I doesn't give any heart procedure. Fever and weakness. Whenever there is a subsidation of fever and subsidation of weakness, then you can give Vaman Dhauti or Shatkarma, all these things. So remember these two words, fever and weakness. And third one is a bleeding. Bleeding. If you have fever, weakness and bleeding, then don't try such procedures. But if you have, apart from these three symptoms, then you can. So this is the effect on respiratory system. See, why we are doing the Vaman Dhauti in early morning? Because in early morning, what happens? See, there is a proper digestion of the matter. Okay, so there is no food matter, too much food matter in the stomach. So the digestive process, yet it is already completed. So it is better. Or sometimes it is on the path of completion. So as a therapeutic purpose, I am always doing this one. Because it is very simple process. Just I avoid this procedure in IHD, that is ischemic heart disease. Because I don't want to take the risk in such a patient, because since it activates the heart rate, so there may be cardiospasm or coronary spasm. So in such patients I avoid this. Otherwise, also in hypertensive patients, but which are non-complicated, I give this procedure, since it controls the cholesterol.
So for people who suffer from arrhythmia, also you would avoid this?
Yes, cardiac arrhythmia, yes, we have to. That is the cardiomyopathy patients. You know, in some patients of cardiomyopathy, it should be avoided. Otherwise, that is the problem after 50 age. So in young age, it doesn't matter. In heart, during the act of vomiting, there is a slightly increase in heart rate for some time. But after that, since there is a vagus nerve is a parasympathetic, it normalizes the heart rate. So why during the act of vomiting in IHD patients, that is ischemic heart diseases, I am always fearing about that heart patients because there may be stimulation or there may be coronary spasm. So I avoid such procedure in IHD who has some ischemic attacks, who has the history of ischemic attacks. I avoid this procedure.
Okay.
So in uncontrolled hypertension and in IHD, don't use such a Dhauti processes.
Now, in normal case, what is the effect?
In normal case, see, that is the thing that in normal case there is a moving of cholesterol from blood to the liver, and then there is a formation of bile. That is the thing that we can reduce the load on the heart, because that cholesterol ultimately gives the load on heart, increases the diastolic pressure. Okay. Once we remove the cholesterol from the blood, from the vessels, we can remove the load on the heart, and so there is a not to rest of the heart or not too much load on the heart, and that is the benefit to the heart by reducing the cholesterol.
People who wear a stent, not to do it.
Who
Have a
wear?
stent in a stent to open up the valves.
See, you can give. If he has no ischemic problem, then you can give. Only the contraindication is ischemic heart disease, because your coronary vessels, the branches of coronary vessels are very low in diameter, and so the small constriction or the small block can make a big problem.
But it wouldn't move the
Ischemic
stent.
heart
The act
disease.
of vomiting wouldn't move the stent. This is what I'm asking.
That in such a procedure, or in such a patient, we have to avoid.
Jolting, the
We
jolting.
have to avoid it. We have after the operations, in the wall operations. So there is a open heart surgery or some closed mitral commissurectomy. That is the wall operations. We have to avoid.